On this special episode of the ASC Podcast with John Goehle, we visit with the leadership of the Texas Ambulatory Surgery Center Society and discuss current issues in the ASC industry in Texas.
Welcome to the ASC Podcast with John Goehle, the longest-running podcast specifically focused on the freestanding ambulatory surgery industry. This episode is sponsored by Surgical Information Systems, providing cutting-edge information solutions for surgery providers and ambulatory healthcare strategies, the nation's leading regulatory compliance resource for ambulatory surgery centers. For more information about our sponsors, please visit our website at ascpodcast.com.
Welcome to episode 142 of the ASC Podcast with John Goehle for October 17th, 2021, recording from our studios in Spencerport, New York, and from the Texas Ambulatory Surgery Center Society's 2021 annual conference held at the Hilton Fort Worth on September 21st and 22nd, 2021. This is Sue Cronkite, Chief Researcher for the ASC Podcast with John Goehle and Senior Nurse Consultant for Ambulatory Healthcare Strategies. Joining me is John Goehle, the owner of Ambulatory Healthcare Strategies and recognized as one of the nation's leading experts in the ambulatory surgery industry. Mr. Goehle is the author of over 10 books on the ASC industry and a frequent industry speaker on regulatory accreditation and finance issues.
So this, first of all, I have to apologize to the state of Texas and the state association there, the Texas Ambulatory Surgery Center Society, because it has taken us quite a while to get this episode out. It has been a busy time here, and we, Sue, you and I, after this conference, had two other conferences we went to. So you've been doing the editing. I've been trying to get the everything together for it, but it has taken us a while. So this was the first conference that I was able to go to in person since February of 2020. Can you believe that's over 18 months? And actually, by the way, I was the first time on an airplane since February of 2020. So quite an experience. It was great to be in person, to see so many of the people that we've come to know and respect over the years in person. It really, it's a big difference between, watching people on Zoom sessions and virtual conferences and actually being there in person. And Sue, you were scheduled to go along with me, but unfortunately we had a client issue. You've been very busy with surveys recently, so you had to stay back and take care of one of our clients who had a survey at the exact same time. But I was able to do it on my own. Unfortunately, we didn't have the studio with us. So one thing that you are going to notice is that the interview, the quality of the recording is actually quite poor, I would say. And we did the best to clean it up, but unfortunately, there's only so much you can do when you're using an iPhone. And then the other problem is, since we didn't have
a lot of background noise, because
a
lot of people excited to be out visiting with everybody, so you could hear a lot of that in the background.
Yeah, we were actually out in a public area. We didn't have, in Ohio and in New York, which we recorded after that. We had our studio with us, our portable studio with us, and we were in a closed-in room. But here I had my trusty old iPhone, and we did it in a public area. So you'll have to bear with us as we talk to the leaders there. This was the first time, by the way, that I was able to both speak at the Texas Association meeting and, be able to record a discussion with leaders of the Texas Association. So we have promised that we're going to do this again, and hopefully next year maybe we'll take the studio down with us and have a better quality recording. Hopefully you'll be there with me, Sue, and I can have a little bit more help in trying to do these interviews. So I was down there to participate in a panel discussion on a topic that I don't generally talk about, which is marketing in an ambulatory surgery center.
So what did you have to say about marketing?
Funny you should ask that.
Yes, I thought so.
Of course, you say this a lot, Sue, that somebody could just name a topic and I would talk about it. Even if I knew nothing about it, I would just make it up as I went along. But
this is one of those areas, though, that I don't think I have ever heard you talk about.
No, and it was interesting. And we talked a little bit about why, I was chosen. And part of the reason is because I have been in the industry quite a long time, and I've seen different tactics over the years, and so it was interesting during the conversation that I actually kind of disagreed with some of the other panelists who were talking about the importance of a social media presence and optimizing your website, and not that I don't feel that that's important, but when we talk about marketing an ambulatory surgery center, I think one of the biggest things that I noted is that there's only really two things that we market a surgery center for. One is to bring in new physicians so that we can enhance the number of cases we're doing. And second is to make sure that patients are well aware of our existence and that we provide high quality care so they can feel comfortable coming to the surgery center. But it was an interesting conversation and, a great opportunity to kind of dialogue with other experts in that field to discuss, what we should be doing from a marketing standpoint. So it was an interesting speech, and we had quite a number of other speeches. Unfortunately, because we didn't have the studio, or I didn't have the studio down there, we weren't able to do other interviews. But while I was there, I did schedule a number of other interviews that we did in Ohio and New York. So we'll be able to hear some of those speeches in the upcoming weeks. But let's take a short break, and we'll come back, and you'll have our interviews with the leadership of the Texas Ambulatory Surgery Center Association. And again, we apologize about the poor quality of the audio here, but we did the best we could to optimize it, and at least we had an opportunity to talk to people in person there. So let's take a break, and we'll be right back. Thank you for being a loyal listener of the ASC Podcast with John Goehle. But did you know that you can enhance your experience and support the free podcast by becoming a patron member? Patron members have access to ASC Central, an add-on service at a very reasonable price. Patron members have access to our regular drop-in virtual meetings where you can discuss issues that you are dealing with in your ambulatory surgery center with the hosts and other members. Members also have access to valuable member resources, including a document library with a growing list of resources, including the rules and regulations, guides to maintaining compliance, example policies and procedures, infection control resources, example risk assessments, example committee and governing body minutes, and over 60 disaster drill scenario kits and example forms and checklists. Members also have access to some of the virtual conferences that we have presented, including the Provider Credentialing Conference, which we offered in December 2020. It's a New World Conference in 2020, Infection Control in-Service to meet the challenges of COVID-19, and the ASC Mandatory Education Program, which is a valuable resource for annual education for your staff. Membership helps to defray the cost of producing the podcast, including the research staff, travel costs to conferences, equipment costs, and production costs. For more information, you may visit ascpodcast.com. To become a member, visit ascpodcast.com. So this is John Goehle. I'm here with Kim Persley. She's a doctor. She's the president of the Texas Association. Welcome to the podcast, Kim.
Thank you for having me.
It's great to be here. I think I told you earlier that this is my first time coming to a live conference since the pandemic started. Yeah. So congratulations to going to Texas for this. Of course, I'm 2 other conferences next week, but it is great to be live here.
It is great.
Yeah. So tell me a little bit about the state association here in Texas and what great things you're working on. I know you've been extremely active as an association during the pandemic and at the after. I guess we can't say that it's over right now, but during this whole event.
Yeah. So the association over the last 18 months has been an amazing organization to be a part of. We have been so involved, so busy. When our state told us on a Friday that we would not be able to do elective cases in our surgery center, we got together over a weekend and came up with procedures that our centers could follow to help them at one point, reopen their doors so we could safely see patients again. So there was a lot of involvement with not only the physicians involved with this society, but also with the administrative staff, with nursing staff, to make sure that we were keeping our patients safe, keeping our employees safe, and moving through this pandemic as we've done. And like I said, it's far from over.
Yeah.
And I think we've done an amazing job to keep our doors open, to keep valuable procedures going. Mm-hmm. Where we know in the hospital systems we've had to
curtail
those procedures.
Yeah. So I guess my question to you is, what do you think is going to happen in the future? Do you think this is going to happen? Is there a chance that they would shut it down here, or what would be your response to that?
In the state of Texas?
Yeah.
No, I think we've learned a lot over the last 18 months. And I think one of the lessons learned is that we can safely do procedures in the middle of a pandemic. We are much smarter than we were 18 months ago. And I do not see our Texas state legislature
going for
anything that shuts it down like it did in March of 2020. So,
talk a little bit about some of the changes you've done. You had to cancel, just like most of the state association, you had to cancel your major conferences. This is your first time back in a year and a half, I think, about. You've been very active. It doesn't mean that you've been sitting back doing nothing. You've been doing, virtual conference. Talk a little bit about what you learned through that process and what you think will still continue as well as things you're going to be doing moving forward.
Yeah, so that was actually one of the really encouraging things, the virtual meetings that we had. The meetings that we had with our legislators, with our lobbyists, with just updates on infection control that were well attended by members and non-members who just wanted to get that additional information.
Right.
So there was a lot of engagement. I think there was a hunger. There were so many contradictions that were coming out about what we can and cannot do, should and should not do, that I think many people saw the society as a valuable resource to get that information. And for that reason, there was a lot of virtual engagement.
Right. We
have a very active board. We have an amazing executive director that keeps us on our toes. So she has, we've pulled together, and I've been pleasantly surprised by how much we've been engaged.
Yeah. So joining us now is Dallas Fryer, who is another one of the board members here. And again, we're talking about how the state association engaged with the membership during this and non-membership, and how you use these new tools that we all learned how to use during the pandemic with the virtual conferencing and things like that. I think that the next question is, how do you think, from what you've been doing, even post-pandemic, now that we're going to get back together, what do you think you've learned from it, and what do you think some of those things that you started doing during the pandemic that you're going to continue doing?
I can just say, as a physician, the challenges that we had early on, we had to change our game. And I think we are so much better. And the things with infection control, hand hygiene, these are all things we should have been doing for years. But I think the pandemic kind of made us realize just how important it is to, listen to our infection controls folks and know that they're doing, they are doing their job. And we have seen, just in general, just fewer people get sick from everything across the board. We didn't have people who were out because of the flu, because of all the hand hygiene and masking. So I think going forward, those measures will serve us well across the healthcare system.
Well, I think it's interesting. I'm a surveyor, and one of the things that we've seen, we used to say that hand hygiene compliance would be in the 60s or 70s. And now, if you're in that number post-pandemic or during the pandemic, you're not in good shape at all. So we're seeing those numbers jump because people are really taking it seriously, not only in the surgery center, but in their own personal life. So they've helped to integrate that into their operations.
I think those things have become habit for everyone. And I think patients are also engaged and asking proactively, what are you doing? How are you doing it? Did you wash your hands? Those types of things.
Right.
And I think for me, one thing that I saw when we had to close down on visitors, we had to really concentrate on taking care of one patient at a time. We got very intentional and very focused with our care during that time, and we've been able to maintain that. And I think that has rebuilt that personal connection with your patients when sometimes it can be hectic in a busy time, and especially now opening back up, and everyone's so overwhelmed with the continued stressors that we're all facing. It really allows us to connect one-on-one with the patients.
So now you went virtual. I know you're doing like every 2 weeks you're doing a town hall, for example, and it has a different topic each time. Talk a little bit about that and how that has helped in your engagement with your membership.
So the town hall topics are very timely topics, and they're hot topics, and they're things that people need to know and want to know more about. The people who are joining have very positive feedback. It is again another resource that the society has been able to give to the community. I mean, it really is not something that we're just kind of holding on tight to, but it is open for other folks to kind of use as a resource.
Right. Where do you think you're heading from here? I mean, are those virtual conferences going to continue? Are you, have you found some innovative ways to even moving forward to continue to use that, mixing that in with your in-person conferences?
Yeah. I don't know about you, Dallas, but I think virtual is here to stay. It's convenient. I mean, the idea of being able to sit in your car and listen to a virtual meeting for 30, 45 minutes during your lunch, a late lunch, I don't think we want to give that up.
I was flying down here. I actually attended a virtual conference on the plane with AAHC. Who could have done that? First of all, I wouldn't have even known how to do it. I'm not one of those
much more
technical
literate now, aren't we? And I think that it allows us. I think both aspects are important. I think being able to get together with industry expert when something comes up and having that ability to do that almost within a week is extremely important, instead of having to wait, let me write that down and we'll be sure and have that at the next conference. It's complete by then. But I do think that it's also important to have the live networking opportunities, if for nothing else than to get out and continue the human connection.
Yeah, it's still very hard. Yeah, it's still hard to get. I've enjoyed this conference so much, getting to see people I haven't seen in 2 years, and I'm sure that's been a great advantage to you also. Tell us a little bit about the conference, and when you put it together, what you were trying to focus on as you were putting the content. I just did a session on marketing, which is interesting because, first of all, I'd never been asked to talk about marketing before, and I can't remember the last time somebody talked about marketing at a state conference. You see it sometimes at the federal, but talk a little bit how you chose the different topics that you chose.
Well, I'll let Dallas answer that since she was on the committee that organized it.
It really comes out of things that we want to know about ourselves. We're operators, we're providers in the ASC industry, and we're very fortunate because we as board members have the ability to interact with our lobby groups. So we're very in tune with what's going on at the state level. And so we tried to pick topics that are going to be beneficial for everybody, all of the attendees, things that we want to know more about, things that we've learned and that we want to spread to everyone else. We want to make sure that we're maximizing value to our members and that we make it worth their while coming out. And we'll continue to do that. We'll continue to ask for feedback. Some of the topics, like infection control, is obviously it's a regulatory requirement that you have infection control training every year, but it's just everything is changing so quickly. And we've got to learn to be agile and responsive. And I think that's what this agenda, specifically even like the marketing, how do you market now? It's completely different than it was 18 months ago.
Well, and social media has become much more important.
And I think the other thing that shaped the meeting is kind of the interaction and feedback that we would get from the different forums and questions that would be posed on the website. And, it kind of grew, I think, organically from there. So these are questions that people would kind of throw out and say, hey, what are you doing with this scenario? And I think those are some of the issues that kind of got incorporated into the meeting in general.
So Elena Fuentes just joined us. We're kind of doing this spontaneously here. So as we're sitting here during the conference, people are joining us and joining in as we go along. Welcome, Elena.
Thank you so much for having me, John.
So we're talking about how the state association here in Texas has been reacting to the events of the last year and a half. And we were just talking about this conference and the effort that went into putting it all together and the types of topics you chose.
I don't want to repeat anything, but certainly the obvious topics at hand, right? How we've been dealing with COVID and infection control.
Yeah.
How we've been dealing with shutdowns and PPE shortages and supply chain issues. But I think for me, the most beneficial thing that I've seen now that we're starting to recover from COVID and are really dealing with staffing issues right now, the most important thing for me was that staff engagement session. And really figuring out how we can boost morale, how we can retain employees, how we can keep people going after 18 months of stress and fatigue and difficulty.
And working long hours and all that,
uncertainty. That's been really tough on them, specifically on my team. And so thinking of ways, especially as we come into the last quarter of the year, thinking of ways of how we can really boost people up to just make it through the final stretch of this year.
It's interesting, during our marketing session, I never even thought about this until we got together as a team. One of the things we talked about is how do we market. We always traditionally think we're marketing to the doctors, we're marketing to, to the patients. But now we're also talking about marketing to potential employees. And joining me now is James McClung. He is also on the board here at the Texas Association. Hopefully this microphone will pick up all of you guys. This is kind of weird, everybody just joining in, but it's all right.
I was just holding up here.
Just following orders.
I listen to your podcast.
Oh, thank you. So what we're actually talking about now is we're just kind of getting a little more granular about some of the things that you've been talking about and things that are pertinent to the state. And I was just mentioning that during a session that I was on, we were talking about marketing. And who would have thought, I've never thought about marketing to potential employees. And yet, when that point came up, it became, very obvious that this is, especially when we're using social media, when we're using all the new tools that are available to us, that is another great opportunity, to get the word out.
Well, we've never really had to do that before, right? I think there's always been enough nurses, enough rad techs, enough surgical techs to really be able to fill your center. I don't think I've ever experienced a staffing shortage to this extent. And so now we have to think outside the box. We have to figure out ways to, especially as an industry, to differentiate ourselves from hospitals, from other places that nurses might want to go to get out of a hospital,
right?
And show what the benefit is of an ASC. And I think what I've seen lately is I've been hiring more people from other industries other than ASC. They've been coming from ORs in the hospitals. They've been coming from even a clinic setting, or from the bedside in med-surg nursing. So really starting to train people in how we do things in an ASC and bringing new outside nurses and rad techs that we haven't seen before.
Get some new blood in.
Absolutely.
Yeah.
And you have to external marketing, right? And transparent pricing. This is a conversation for another day. But internal marketing, I would argue, is more important because that's when you start talking about culture. Elena and I were actually in a meeting the other day. It was a meeting of the minds, I guess, of an organization, and the CEO, he had 14 characteristics of leaders, right? And they were very short, simple explanations of delegation, right? The characteristics of the leader. And to internal market that, right? Very nice and neat, or come up with a committee ideas of how to put that on the wall, right? And when people see that, they want to emulate it. They see that it promotes stakeholders to be more invested in the center and take ownership of their experience in the workplace.
You know, it's interesting to bring that up. We've been talking quite a bit on the podcast and in the virtual conferences we're doing. We started up these boot camps in the last year, which have become extremely popular. And I think, first of all, nobody had ever done it in the industry, but we started because suddenly we're getting a lot of people from the hospitals. We're getting them from outside of the ASC industry, and they come in here. Yeah, let's face it, we know that some of the nurses out there that came to the ASCs think, oh, it won't be so tough over in the ASC side, right? This is where I go when I retire because things will get easier. Well, they learn very quickly that doesn't happen. Yeah. Well, I've often heard this. When I'm a surveyor, for example, I'm often hearing people say to me, well, we don't have to do that in the hospital. We all know that the hospital has higher standards. Well, not at all. So talking about that right now, where do you feel you're heading in the state with regard to your relationship with hospitals and how you're starting to kind of move cases away from the hospital, as well as trying to attract those people from the hospitals that you want in your environment now?
So I am on staff of one of the area hospitals, and it's been quite frustrating during the last 6 months because of the start and stops. You know, you can schedule, you can't schedule, or you can schedule and then it gets denied by someone who's reviewing the case. And not only frustrating for me as a physician, but extremely frustrating for a patient who is now pushing off a procedure 9 months, who really needs to have this procedure. I've had patients who I would love to bring them to my ASC, but for health, other significant cardiac history and stuff, we feel like they need to be done in the hospital, and they are begging to get these procedures done. And I understand where the hospitals are coming from, but as an endoscopist, we're being told, okay, we can't do procedures because of the risk that they may need hospitalization afterwards. The last time we had to hospitalize a patient after an endoscopic procedure, 3 years ago. And we're missing, there's gonna be a delay in diagnoses of cancers, and I'm really worried about that.
We're already seeing it in some of, we do a lot of GI centers. We're already seeing an uptick in the number of those diagnoses.
And Dr. Person, you're spearheading the elective name, right? Are you? I know we've talked about it at least a little bit of how that name really labels a procedure that might not necessarily be elective.
Sure. So, in our hospital, a screening colonoscopy is considered an elective case, or a non-urgent case. And those cases are no longer, we cannot do those for several more weeks until we get clearance. But those are important cases that are not being done.
It's a bad term.
It's a bad term. So we are getting as many of those folks that we can safely do at our surgeries. And, we've had a group of patients who for years didn't want to come to the ASC because they're like, oh, I want to have my procedure done at the hospital. People want to stay clear of the hospital. They do not want to be anywhere near the hospital. So we have those very COVID afraid folks who are wanting to shift everything to the ASC. So, there's been a lot of movement on the part of physicians and patients moving cases. The hospital systems, I think they're still trying to catch up. I think they're still trying to figure out how to do this. And although it's been 18 months, it's still a struggle. I mean, every couple of weeks we are getting a new email about, okay, so we're not going to do this, we're going to do that. And I think as far as we're concerned, once we made changes, we kind of stayed on a certain course. So that's where things are with the relationship that I'm having with the hospital that I'm affiliated with.
Well, one of the arguments I've been making recently is that the role of the hospital is starting to evolve. Thankfully, that we know that the hospital needs to be there. In my hometown right now, even before the pandemic, we had 95% occupancy. There was no built-in fluff. There was no ability. During the flu season, we were over 100%. We can never get back to that place where we have to open up more hospitals, and because these are going to happen again. Pandemics are going to happen again. And I see that the role of the hospital is starting to change And perhaps we need to find a way to safely shift those cases that you are doing in the hospital, as you said, that probably really don't need to be done there, but because of a regulatory compliance issues or because, surveyors and regulators are not comfortable moving those yet, that we need to make a shift in that.
And I would also say, though, and I would challenge, especially the independent ASCs, that the game is, to push towards the hospitals, right? And the only way that you're going to change that is knowing what you have and what you want, right? Mm-hmm. And right now, especially on the independent side, we are a private industry, right, on the business organization side, and we have not united our resources, our leverage. And if we were able to do that, I think we would find that our communities, our states, our nation would be able to take advantage or work with us on a peer-to-peer level of what the square footage that we have, what is an appropriate use of ASCs in an emergency, right? Being able to push those cases towards an ASC, and then how that structure of payment is going to work out, equipment, right? But the one thing that I would say that ASCs should not do is they should not wait to have a government agency or the way that the system is set up now to implement its will on the ASC industry, right? We need to unite and we need to find out and leverage our resources in order to increase volume.
Well, and that brings up probably the last thing that we should talk about is what's going on from the legislative standpoint in Texas. Where are you now? What are you working on, and where do you see us moving in the future, particularly in light of what we've just been talking about?
So, in my stance, we actually have a bill, an emergency management bill. CMS has a regulation where we are required as an ASC industry to be a part of a community tabletop drill, right? Or be a part of the community emergency management. However, here in Texas, until April of 2020, a lot of people didn't really know what an ASC was. So we were definitely not a part of the Texas emergency management system. Fortunately, we've had some experience from members working at the hospitals and being a part of the emergency management system. So when we were shut down, without choice,
right?
The first thing that we thought of was, emergency management is protocols, right? And so these protocol people, they just open up this big tome of protocols and say what to do in a pandemic, right? And if it doesn't say ASC on there, we're not going to call ASCs, right? So, it's a balance. We have to educate. We have to define. We have to unite. And that is part of what the bill is doing, is trying to get a voice for ASCs at the table. We don't want to have every ASC, have a representative in the emergency management, right? But we should have at least a singular person that represents the voice of the ASCs here in Texas, what resources we can have, and how we can provide those resources to the community, especially in emergency.
What do you think your biggest challenge is right now in the state from a legislative standpoint?
I would say, to go along with what you were saying, is getting the surgery centers involved and knowing what's going on. In one of the sessions earlier, James, you were talking about how our regulations are being moved. Our rules and regulations are being moved within the administrative code, and probably 90% of the surgery centers in the state have no idea that that's going on.
Yeah.
And it's up to us as surgery centers to tell the state how these changes will impact us, how their vocabulary that they use and their definitions that they use don't apply to us. And because when a surveyor comes, they're not going to know. They're going to say, no, this is what it says, and you're not doing it, so therefore you get to either stop working or give us a bunch of money. And we have to get that message out. And so that's really really the foundation of what the Texas ASC Society is here for, is to make sure that we get information out to all of the Texas ASCs, and hopefully most of them come back and get involved and give us feedback, because we represent all of them, all of our members and all of the surgery centers that are not members.
Right.
We're their voice.
And I would say, John, I think we're in a good position now in time to do that, because this pandemic has brought about all of the issues and concerns with hospitals, and cost and staffing and infection control are big issues in hospitals, whereas an ASC can mitigate some of those a little bit more, and we have a little bit tighter control over those.
Right.
Where people before maybe didn't know what an ASC was, maybe they've heard about them now. Maybe they understand the difference between hospitals and ASCs. And where they don't, our group in particular is working with our state to go to our legislators and explain the difference. So we do, it's been tough through COVID not being able to do advocacy days, but we've figured out ways around it by doing virtual advocacy days. We do virtual tours through, Zoom meetings or even FaceTime with our legislators, just walking them through a facility. So just opening up their eyes so they understand that there is a difference between a hospital and an ASC, and that our administrative code doesn't need to lump ASCs in with hospitals, so we can make different rules and regulations around the different abilities that we have.
How's your relationship with the Department of Health right now in Texas?
So I think we have a good relationship with them. And honestly, it's not any kind of business speak. I would say that they have a lot going on.
Yeah.
And I do wish that there would be an increase in communication and response, right? And I do understand there could be some barriers there because on purpose. However, let's talk it out, right? Let's figure out how we can move forward together. How can we reduce some of that burden on you so we can have a better environment for the patient? And sometimes, just when you have a regulation that comes through and says, we're changing this or combining this to have access to whatever we want, whenever we want to, or when rules flip-flop back and forth between, one center to the next, right? And it doesn't have to be that way. It could be more regulated. The relationship could be streamlined. However, I think that's just not in Texas. I think that's everywhere. That's in general.
Yeah, that's very true.
But from a personal standpoint, we have wonderful people that work there. Rebecca Reed, she's the head of the architectural unit. Pamela, she's the head of the licensing division, and we can't do it without them.
So joining us now is Adam Hornbach, who is also on the board here. And, Adam, we're talking about the legislative issues that are coming up right now. And I'm just going to open up to everybody to talk a little bit about some of the wins and some of the things that are in process right now.
So I think we mentioned this a little bit earlier. So the legislative folks in Austin know who we are. And a couple weeks ago, I had an opportunity to go to an event where there was a Texas state representative there. And I went and I introduced myself. And she's like, "Oh, I know about you guys." So that actually said a lot, that someone knows who we are and they value what we're doing.
Yeah.
And I was like, oh, okay. So it felt really good to know the word is out.
It's working.
Yes, It is working.
So what has happened here? What are some of the initiatives that are kind of hot?
So right now we are pushing for a surgical smoke bill. It got bogged down this last session, so I think that'll be revisited this next session. Everybody's on board with that, and I think that'll be positive.
We've made some wins with the Texas Department of Insurance when it comes down to balance billing.
Okay.
Right, in arbitration with that as well.
We were talking about that I brought up to the team is the ASC lobbied hard when COVID shut everybody down. One of the things that the RAC and the emergency response systems wanted to do was they wanted to shoot us their ICU patients, their overload ICU patients. Well, that's something that the Texas ASC Society lobbied hard to make sure and get in front of the governor and get in front of our representatives to stop that. So that never happened here, and that was, I think, in big part because of the lobbying effort that we put forth. So,
and lastly, just kind of talking about where what you're trying to do to recruit new members, the benefits of membership in the association.
Absolutely. Being an advocate for the ASC Society, I think, is one of the biggest that we can see. We constantly are looking out for our ASC brethren for, as far as legislative things that are coming down the pike to catch them before they, instead of after and trying to fix it. Be proactive, get in front of our representatives and, stop nonsense that will either hinder patient care, and unnecessarily regulations that are unnecessary, or maybe something that does need to be necessary.
Absolutely. We have a very, I wouldn't say super large, but we have a large, showing on social media. As Adam would say, like and share. You made that up. And
stole my line.
Yeah, I posted quite a bit to your LinkedIn page.
That's trademark infringement right there. He did. Wow.
I had to give you credit because it was brilliant and so simple. But, consistently, we are either, between 1 and 3 between CASA and ASCA when it comes down to new likes on our LinkedIn page, Twitter page, Facebook. And the only reason why I know that is because we have an outstanding team, the best, when it comes down to Jennifer, Krista, Courtney, our lobbyist, Taryn. The most amazing team. That we're very gelled, and I think that when we get together, we certainly like to argue appropriately.
Well, and I got to say, also on behalf of the podcast, we do track statistics. Sometimes between 25 and 30% of our listeners come from Texas. Now, of course, you're big. You're a little bit big here, but you're well. And of course, we engage with you also on LinkedIn.
Absolutely.
We cross pollinate a lot there. But we would encourage. We'll put a link on our show page for this to people to sign up. And so, when's your next conference? Live one.
We may, I guess we need to talk about our winter infection control conference. So actually, somebody else asked me about that earlier. They said, are you still doing that? So,
we generally try to do 2 a year. We try to do an infection one and then our annual.
Okay. Yeah. And so has it been set yet, or?
Not yet.
Okay.
Our timing is off because we did an infection one this year already. So our timing is kind of off, so I'm not real sure.
Well, I'll get the information from Krista, and we'll make sure that we post.
But we'll have a town hall in 2 weeks.
That's right. So every 2 weeks you have this town hall. What day of the week is it?
It's a Thursday afternoon. They're short and sweet, 2 to 2:30.
And it's for members?
That's correct.
Yes.
Now, if you're not a member and you are a Texas ASC, please reach out. Please Google it, because you will be able to attend. We want you to see the benefit of the hard work that our team is doing. The content expert for that topic is, a leader of a Texas ASC, and will be able to help, and is there for you to, as a resource, as a tool. So please take advantage of that.
I think part of the our membership is great, and I think part of the reason why we may not have more members is that I think the society has done such a great job moving in the background. People don't realize all the moving parts and what is taking place to get
and who was responsible for getting it.
And so having folks that think non-members come to virtual town halls is actually, I think, really helpful.
Right.
So they can see, this is all the stuff that they're doing to kind of move the agenda forward. So,
And there's a great forum on our website where anyone can go in and ask questions and get directed to what is available, or get linked up with the appropriate person to help them work through their issue.
Well, thank you so much for inviting me out here. It's been a pleasure to be out here. I've already told you I'll be back next year, and it is a pleasure to work with such a great group of people here and dedicated people. So on behalf of all of our listeners, thank you for all the work that you do.
Thank you, John. Appreciate it.
Thanks, John.
So this is John Goehle. I'm here with Susan Cheek, who is with Dallas Endoscopy Center and a former president of the Texas Association. And you are, like I am, a CPA. So we did the secret handshake that nobody else knows about, before we started the interview here. But Susan, welcome to the podcast. I'm sorry that you missed the rest of the crowd, but you have some unique skills and a unique perspective from being the immediate past president. So first of all, let's start by how has this organization changed since you were there? One of my favorite stories is that my favorite title is immediate past president.
Oh, that's right.
So you're probably enjoying that, especially during the pandemic. So talk a little bit about how the organization's changed in the last couple of years since you were president.
Well, we really have a much bigger social media presence. We've partnered with a very good firm that is our lobbying firm that has very much depth to it. So besides representing our issues for us legislatively, they also have a very deep bench, I would say, of people that help us out as far as our social media presence. All the way to whenever the legislature is in session, tweeting out what's going on that day.
In real time.
In real time, and then tracking for us, all the hits that we have to our various websites, what different topics are trending. We really did not have a big media or social media footprint, and now we do across quite a few different realms. So, and they do a monthly meeting with us. They come to our monthly board meeting and give us an update, so we can really see what things we're doing that's working and not, and do like a weekly recap to all of our members to show what's trending on the different social sites. So that's been really good.
That's great. Now, you're also, you come from the financial side here. We were talking just before we turned the microphone on here as to some of the challenges in Texas right now from a financial standpoint. So you can talk a little bit about some of the things that are going on that, kind of affect everybody from a financial standpoint.
Okay. So I think that with the transparency laws that are coming down, I think both at a state level and federal level, we should be lobbying for more transparencies from the insurance companies about what coverages patients have. While benefits are available online, they're not all we need to know as a provider on really how much it's going to wind up costing a patient. For instance, a screening colonoscopy. Do they have screening benefits? These are not things that are readily returned to us. So if the insurance companies were legislatively made to put a patient's whole coverage out there and return it, that would be very beneficial. And also to have to keep their records more up to date of who is eligible. So a patient may have coverage one month and not the next, but the insurance company is lagging in updating that. So you may verify, think the patient has coverage, find out later they did not have coverage during that time period. Now patients are mad. So I think that those are things that as these transparency bills are being passed that we need to be pushing back, that transparency needs to come from both sides. Because our information to the patients is only as good as the information the insurance companies give us. So that's one. I guess, during the pandemic, we just come through quite a few different challenges, being shut down on elective procedures that, financially impacted a lot of us. And being able to, if you had a really good relationship with your banker so that it was easier to file for PPP loans, I think that's a very good lesson to be taught here, because we don't know what's going to continue to happen. And I think that people need to have good relationships with their bankers and things so that when these PPP loans come out, they can find out what they do qualify for and even what's out there.
And react pretty quickly to it as opposed to being reactive to it.
Right. And make sure that you're taking it out or you're using it in a way that you'll be forgiven so you won't owe it back. The same thing with the HHS monies that came, and now we're in an attestation period for that. And there's if you really need to know how to do your attestation so that you don't have to pay it back,
And don't forget, those of you that are listening before the end of September, the September deadline is coming up. I know that there's a little bit of a grace period there, but don't go too far into that grace period.
Exactly.
Do this pretty quickly.
And and then other areas was insurance coverage. So we here in Texas, we had Winter Storm Uri in February that shut most everybody down for a week for a large part of Texas, and insurance for that. So business interruption insurance. Initially our business interruption insurance denied us because they said, well, you weren't shut down because you didn't have property damage. So usually business interruption insurance is if you had damage to your, so I pushed back there and said, well, we could not be open because our generator would not run. And by law, we have to have that. And because it went up and down, it truly did tear up our air conditioning system and our computer system. And so we were able to successfully get loss of revenue for that week and also for our equipment that was damaged. And that was a good thing. And so I guess what I'm trying to say there is you need to really look at your insurance coverages. And even for during the pandemic, a lot of people's insurances said they don't cover for a microorganism, but there's a lot of lawsuits going on right now that people need to be watching. And I'm watching. And if those go in our favor, then that. So there's there is some of that going on too.
What do you think the future is for ambulatory surgery centers in Texas right now from a financial standpoint? Is this a good time to be starting a surgery center?
I believe so, because I see with the payers, they seem to, after all this time, they seem to start to want to be our friend. They're starting to wake up that we are a high quality, lower cost alternative to the hospital.
Accessible.
And accessible. Hospitals are great, so I'm not, downing the hospital at all. But I've seen more and more payers driving their patients towards ASCs, and I'm seeing more payers want to contract more favorably with the ASCs.
Well, I think that, we were talking earlier about how, hospitals have a very important role. And perhaps that role isn't necessarily doing, I don't like this term, elective surgery, but, doing procedures that can be done safely elsewhere. Save the hospital for more critical cases, save the hospital for those times when we really need it, like during the pandemic.
Yes.
And I think that's where we, as an industry, have come into the big time, really, during this time, as people are realizing we are the solution.
Right. And the whole, hospitals, I guess, without borders or the walls,
where they convert to a hospital temporarily.
Yes. The ASC is very well aligned to do this as well. And I know there's many in our state who's had success at that. And one of the things, to your point, is, the hospitals are seeing the COVID patients. They're seeing the very sick. And for that reason, it kind of makes the ASCs a little bit safer from that standpoint too, because we're screening out for COVID. We're not trying to treat COVID patients. And so it does make it maybe a safer area for that as well.
Well, why take the chance? If you have another option and it's a high quality option, why take the chance? Those hospitals, they have a very important role, and we need to keep them available for those critical cases. And there's always going to be cases that we're not going to be able to do in the surgery center. There's a high likelihood the patient's going to have to stay overnight, et cetera.
Yeah.
Well, Susan, it's been a great pleasure speaking to you here. Thank you so much for joining me.
Thank you for having me.
We would like to thank our sponsors, Surgical Information Systems, providing cutting-edge information solutions for surgery providers, and Ambulatory Healthcare Strategies, the nation's leading regulatory compliance resource for ambulatory surgery centers. For more information about our sponsors, visit our website at ascpodcast.com. This podcast has been an educational and operational tool and is not intended to be a comprehensive resource for all rules, regulations, and standards that an ambulatory surgery center must meet. The advice provided should not be considered as, nor does it constitute, legal advice or opinion. When reviewing specific situations involving legal and regulatory issues, attorneys and other professionals should be consulted. This has been a production of Eden Group Development. All rights are reserved. If you're interested in advertising or sponsoring the ASC Podcast with John Goehle, please email us at info@ascpodcast.com. We would love to hear your questions and comments. Please email us at comments@ascpodcast.com.